Hello guys, welcome to my YouTube channel. I am Denmark Aranas, a postgraduate medical intern, and I basically provide informative videos to medical students. And also, I would like to give aspiring Filipino physicians an idea of what a medical student usually tackles in med school. So if you find these videos helpful, please don't forget to click the like button and subscribe to my channel and hit the notification bell to be updated of my new videos that I'll be posting every week. For today, we'll be talking about the clinicopathologic correlation of pneumonia as part of my CPC series. The objective for this discussion is for you to know the explanation behind the manifested signs and symptoms of a patient with pneumonia. Okay, so a simple definition of pneumonia is that it is an infection of the lungs caused by either bacteria, viruses, fungi, or even parasites. Okay, pneumonia is a very common outpatient department case. We frequently encounter pneumonia from low, moderate to severe cases. And this is very important to discuss as currently in light with the COVID-19 pandemic, it is the most frequent manifestation of it, from mild to severe acute respiratory illness. Okay, so it is important for us to know the clinical pathologic correlation of pneumonia. So here is an overview of what we will be discussing, and we'll be going through each of these parts. Okay, so let's start. In discussing the clinical pathologic correlation, we always start with the risk factors. And these risk factors would be the predisposing factors of the patient for them to get the disease. Okay? So important risk factors that we have to consider are the following: the age of the patient, them belonging to the elderly group age predisposes them more to having pneumonia. And in addition to that, having comorbidities also worsens the or increases the likelihood of acquiring pneumonia. What are these comorbidities? It includes diabetes, hypertension, uh, cancer as well. Okay, so these comorbidities lead to decrease in immunity in our patient. Okay, while being an elderly patient, they are more having a less reflexes for cough and gag reflexes. These are defenses that we use to prevent having pneumonia. And for the elderly, these reflexes are diminished. Okay. And then for the elderly, they also have decreased antibody and toll-like receptor responses. Okay. So combining the two, it would lead to impaired host defenses, leading now to increased aspiration and multiplication of the pathogen in the alveoli. Okay, and then the manifested symptoms would be due to the inflammatory responses of our body against the colonization of the pathogen in the alveoli. Okay, so next, here are the inflammatory responses that our body produce in response to the infection. And we'll go through this one by one, starting with the release of interleukin 1 and tumor necrosis factor. This would lead to the fever, increase in body temperature in our patient. Okay, so If you have the release of interleukin 1 and tumor necrosis factor, it would manifest as fever. Next would be the release of interleukin 8 and granulocyte colony stimulating factor would stimulate now the release of neutrophils. These neutrophils would accumulate, leading to leukocytosis, and it would cause the increase in purulent secretions in our patient. So that would manifest as productive or um, productive cough. Okay. Next would be the inflammatory mediators of the macrophage and increase in neutrophils. This would lead to alveolar capillary leak. The alveolar capillary leak would lead to manifestations of hypoxemia, increased tactile fremitus, crackles, and in the chest x-ray, it would be identified as infiltrates on the uh, x-ray plate, okay? You could also have hemoptysis from the capillary leak, as when the patient coughs, there would be exudation of blood as well, okay? Next would be the inflammation of pleural lining of the lungs and chest cavity. This would produce pleurisy, which means the patient would have chest pain. And this inflammation of the pleural lining would also stimulate the cough reflex of the patient. So everything would now lead to systemic inflammatory response. And that would lead to increased respiratory drive and would cause easy fatigability of the patient, and they could experience nausea and weakness. And overall, this would be manifested by dyspnea, okay? Dyspnea or difficulty of breathing, okay? So a very common manifestation in patients with pneumonia would be tachypnea and difficulty or shortness of breath. So we always have to make sure that we count the respiratory rate of our patient. So everything I discussed here came from our reference, Harrison's Principle of Internal Medicine, 20th edition. I would like to end this presentation with a quote from one of my favorite inspirational movies, The Three Idiots. Okay, Rancho told us that we don't chase success, we chase excellence instead, and success will follow. As medical students, we must always strive to give our excellent work in everything that we do. We must never settle for mediocrity because mediocrity kills our patients. Remember, we must always be the best for our patients. We do not want to put them in danger just because we don't know enough. As future doctors, always maintain excellence in all that you do for the sake of your future patients. Thank you for listening and have a good day.